Hyperacute stroke units, which is what HASU stands for, are they're the national accepted best practice. So we know that patients going into a HASU have really good outcomes, and the reason for that is to do with coalescing all of the expertise into one place, seeing lots and lots of different patients, but so many that you become very quickly expert in managing their pathway from when they present with a stroke. So there's quite a lot of good evidence to suggest that if you see a certain number of patients a year through a HASU, then you're going to have better outcomes. The other thing about HASUs is that they just provide a focus for education and research, so patients get the best care that they can. The staff working in the stroke units across Kent and Medway are all working very hard and do an excellent job in the care pathways within which they work. And I can't emphasise that strongly enough. And certainly all of the staff that I work with on a day-to-day basis, all they want is to provide the best quality care for patients who have had strokes. The problem comes in the fact that we can't attract the number of staff that we need to man all of these stroke units. You know, Kent and Medway is surrounded by sea on 2 or 3 sides, and there's London to the north, and it is quite difficult to attract staff, and we have a lot of vacancies all of the way through the stroke pathway. And I believe that actually if we offer a contemporary service, a service which is seen as national best practice, we will attract staff to come and join the hard-working staff currently working on our stroke units and make it a more robust service. And with a more robust service, care and the quality of care will increase. A patient coming into a HASU will first of all see the doctor in person. So from my point of view, I much prefer to see and be with my patient, to be able to examine my patient fully, and because I feel I can relate to them better, communicate with them better. And from a patient's point of view, I think that's the same for them. They would prefer to see the doctor in person. At the moment we use in many parts of Kent and Medway we use a telemedicine solution to provide this thrombolysis drug which we can give to patients if we give it to them quickly enough after they suffer their stroke. If we're face to face, we can actually get that clot busting drug into them quicker than using a telemedicine solution. I think that's one of the main differences that a patient will notice. It's their service. You know, this is the service that they will rely upon if, God forbid, they have a stroke themselves. Or, and so they know what they want. They know what they expect from contemporary health care and the provision of stroke services. They know what they want. They are our customers, for want of a better word. Also, I'd like to also encourage people who have had strokes to get involved as well, because I'm only a stroke consultant and I can give my view from a stroke consultant point of view, but the important view is the people that have been through the service. They know what it's like at the moment. They know the areas they think that there could be some improvement, and it's their service. So I would be really, really keen to as many people as possible to express their views.